Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, here with my guest, Scott Kaiser from Determined Health. Scott, thanks for joining me today.
Great to be here. Thank you.
So I saw you just yesterday receiving an award right here from CHIME. Tell me what that was for.
Yeah. This has been great. Lots of momentum for us. That was ScaleHealth partnered with CHIME.
Okay.
On a patient engagement challenge.
Okay.
And we were a finalist in the digital front door.
Okay.
Which is really cool.
It's a good segue into what Determined Health has built.
Yeah. So it's cool. It's got us thinking a lot about how we fit in that schema of the digital front door. You know, we've built a connected community care solution that really focuses on addressing loneliness and other social determinants of health. And so this community care solution, it's all about curating networks of community partners, training a workforce of community callers, driving engagement to manage social determinants proactively. So, you know, how does that all fit with the digital front door?
Yeah.
And it's really cool, and we're getting this warm response from the health systems too. They're seeing it the way we're seeing it. We're like a Walmart greeter at the digital front door.
Okay.
So personal, all about human-to-human connection, but with leveraging technology underneath to make things scale. So we're bringing people in. We're meeting people where they are, right? It's Walmart greeter. You could take the analogy a little further.
Yeah.
They kind of follow you around the store in a non-creepy way, you know? And then...
anything I can help you with.
Yes, anything they can help you with.
Yeah.
So there's a lot of people, great to have a digital front door, but you're going to leave a lot of people behind out in the cold.
Yeah.
So we're just bringing people in through human-to-human connection that's tech-enabled.
Okay. What's the patient experience if there's a community that they're in that's using your platform?
Yeah, so, you know, imagine you're a patient who is cycling in and out of the ER. You got multiple chronic conditions. They're all out of control. You've got all sorts of crises. You're going to the ER multiple times even a month.
Yeah.
And so, you know, somebody notices, hey, something's really not working here.
Yeah.
We'd like to refer you into this program. Well, we try not to use the P word, but hey, we've got this new great service that might be a good fit for you. So then that name is given to us. We reach out to them. Our engagement rates are really good with our approach in reaching out to people. What we do is we offer pairing them up with somebody who's just been trained to be a good, empathic listener.
Okay.
These people that they're paired with, they might be a paraprofessional, they might be a trained peer, a student, all sorts of people.
Someone in their community or someone at your organization centrally?
No, in their community.
Oh, cool.
And that broadly, that might be very local, or that might be another part of the state, or maybe even a further geography. But
not just one central call center.
Exactly. No.
Taking care of
Exactly.
Got it. Okay.
Exactly. And those folks come through relationships with trusted community organizations. So you're not just getting a link to a person, you're getting a link to a whole community.
Who do you work with? Who's that person who refers? So who's kind of the spark of the relationship?
Yeah. I mean, it depends, right? It depends on our customer relationship. You know, we have situations where we're used just as a pure SaaS platform, and all the internals and everything are all done kind of internally. But, you know, ideally, you think about somebody who, you know, on a care management team, we do a great job of extending the power impact of nursing and social work care management.
Okay.
Right? So you imagine somebody, you know, they have a lot of responsibilities. They're doing their health risk assessments. You know, they're checking in on people for a variety of clinical things. They don't have the time to just chop it up, just get on the phone and just talk about, you know, that crazy thing that happened last night at the game, whatever it is. And then that's what our folks do.
Sure.
Right? But at the same time, we give them the tools to be an early warning system at the same time. So if see something, say something, they don't need to do anything about it. They just flag the issue. Oh, person's really struggling with access to food. Boom, goes in our system, gets routed to the care management team, gets routed back to the Meals on Wheels program.
Got it.
So that you can connect the person with a home delivered meal, and that could be the thing that keeps them out of the ER.
Interesting. So if I'm one of your community health workers who's been trained on the system, I've been trained to be a great active listener,
Yeah.
Am I reading through a script? What kinds of questions am I asking?
Right. Yeah. No. Definitely no script.
No script. Okay.
No script. They are trained to engage a person in conversation and to
Okay.
be a good listener. And a lot of good listening, is active listening and following. You might be with somebody who really likes to talk a lot.
Yeah.
You might be with somebody who really is a little more reserved and likes to listen. Understanding that to make the right match is part of what we do. But then for our training, for our callers, understanding how to adapt to the situation to be the best listener they can be, the best support in that situation. And their job is just to connect.
Okay.
That's their job.
And they're on some sort of determined health CRM style platform where they can say, John Smith has this concern. That's where they can red flag things for future.
Yeah, what's even better is they don't even need to log into the platform either.
Really?
So they'll just get a text message, for example, after the call
Fascinating.
to say, with a checklist of things, that were there any issues around social isolation, transportation, food access, financial, healthcare follow-up, and a notes section on, just like anything you'd like to share about the conversation today, anything we should know.
And that data goes where?
So that data comes back to our platform where whoever the organizational administrators, have that. In the case that we were just describing, that would get routed back to the care management team.
Okay.
So they would see that. It shows up on a dashboard for them with a flag, and sort of with an action flag, and yeah.
Awesome. What are some of the metrics that you track in terms of reducing costs, improving quality?
Yeah. So, obviously we want to hit everything in the quintuple aim, and I think we are. All the aims. And I think, we are. Early data shows that, and we're continuing to collect data in all those regards. The biggest impact we've had that's been most meaningful to our customers, surprisingly, we're fixated on reducing costs and improving outcomes, but our satisfaction, I mean, that's been because, the next measure I need to add, anybody who listens to this video who has a good measure for this, the one thing we'd like to add is a measure of trust.
Interesting.
Right? Because that's what we're really building, is trust and engagement. And people
I actually talked to a founder just a few weeks ago who was working on that idea.
Oh,
yeah.
good.
So I may have to make a connection.
I would love that.
But
I would love that.
So trust as a metric. It's tricky.
Yes, trust as a metric, which is so, look, we're determined to transform care. That's what we're all about. But for us, it's about hitting kind of those core fundamental shortcomings of our care system, particularly when you think of complex, high-risk, high-need, vulnerable populations, and it's lack of connection, it's care fragmentation, and it's a breakdown of access and trust. So we know we're increasing trust. We'd love to measure that. And we see that as the gateway to address a broad range of issues, which will result in reductions in emergency room visits, reductions in unnecessary readmissions, and ultimately, with my as a geriatrician, keeping folks out of institutional settings, right? Helping support people in aging in place.
Yeah, really a force multiplier in an age of workforce crisis within this market, correct?
Yeah, exactly. Exactly.
You mentioned you were a geriatrician. We didn't really talk about how you got into this.
Right.
What was that path like?
Yeah, well, I mean, it's been, I trained as a family physician.
Okay.
Community health is in my roots. I trained at a federally qualified community health center. Our whole program was focused on the care of underserved populations. And we were really, by us, our residency program being there, we were reducing teen pregnancy, reducing infant mortality. I mean, it really a kind of a public health perspective.
Yeah.
Then I got into geriatrics, and it was like, back 2008, they're saying, wow, the first boomer is collecting Social Security. We're going to have 10,000 people turning 65 every day. Meanwhile, we have less than 7,000 geriatricians in the entire United States. So little by little, I built a career as a leader in aging services and innovation in geriatric care. That I've gone on now to leverage that experience and that network to help, to build our vision and build our model. And really our objective is now to do that at scale.
Got it.
And that's where my co-founder, Catherine Steinberg, she comes in because she's a care transformation specialist. Her whole, expertise, network, everything, she blows my mind. I pinch myself that we get to be on this journey together. She's able to help us, really plan out, execute to be able to do this at scale. And then, of course, bringing a third technical co-founder in Charles Johnson, somebody who can help us build the technology the right way, that's solving problems that matter to people in a way that works for them, frictionless for the end user.
Yeah. Last question. You've been in this industry for a while. So much talk about age tech and where we're going. How have you seen the attitudes and change over the last few years in terms of the acceptance of technology, kind of the idea that we need an inflection point right now and we need change?
Yeah. Well, I'm really excited. We are at an inflection point. The quality of solutions. We've been talking about it for a long time. There's a term, the silver tsunami. I always take issue with that. I call it the great age wave.
Okay.
Tsunamis come without warning, and they're super destructive, devastating, terrible things. This is awesome that we gained 30 years in life expectancy over the last 100 years. We're living longer. It's a great thing. And there's so much power and potential in an aging population, and there's a whole longevity economy.
Yeah.
And so it's really great to see that this is becoming something that people were sort of preaching from the mountaintops is now, it's in the grassroots, it's in the water, and the quality of services and innovation, it's just phenomenal.
Yeah.
We're just seeing, and so we're hoping to just be part of, that leading edge, and then lead a groundswell. We're not worried.
Surf that
great age wave.
Yeah.
I'm telling you, because we're not worried about competitors. We're trying to catalyze a movement here. That's why we're health transformers, and that's why we love being part of the StartUpHealth ecosystem.
I love it.
Because we've got big problems we're taking on, and so it's all hands on deck, is what I always say.
I love it.
And yeah, we're in it.
I love it.
Yeah.
Scott, I love what you're building. I love the heart behind the business, and it's going to be exciting to see where you take it the next couple of years. So thanks for joining me today.
Thank you so much.
All right.
Yeah.
Take care.
Yeah. Can I also mention one other thing while we're here then? Just in terms of all the momentum, updates and whatnot, we got just a lot of cool things going on. But I just wanted to mention this too, because I think it's a great opportunity also for other startups to get involved. The Prime Health Innovation Challenge focused on safety net populations. So we're also a finalist in that. We're going to be doing a pilot demonstration project in Colorado.
Oh, congrats.
And so this is a really cool opportunity, something that I think we could do in Colorado, and then hopefully, continue to spread, very much aligned with our model. Working with a rural health system provider that they've been surveying their community, they've been looking at their challenges, and they said, biggest problem, socially isolated, lonely, older people, core issue, and they, like us, see that as sort of this linchpin issue, this kind of the cornerstone thing that you need to address. So we're going to work with them to do it, bring in our whole model, curate that network of community partners. And excitingly, there may be an opportunity for Colorado Medicaid innovation directors to work with us to look together at the metrics, so that we could really look at rolling this out across Medicaid, in Colorado as sort of baked into the program. That would be transformative.
That would be huge
for all of us.
Yeah.
And so Rachel Dixon at Prime Health, really just so appreciative. Really excited to be part of the CHCF cohort on Medicaid innovation. So just really excited in the kind of duals and Medicaid innovation space. So a lot of momentum.
Yeah, what I'm hearing is that there's just a real collaborative spirit behind this right now, that people want to work together and figure out how to plug innovations into populations that they're working on.
Yeah.
There's a desire to raise that tide.
Yeah. Yeah, being an entrepreneur is not easy, and there's all sorts of challenges along the way. But when you're in this sweet spot where your challenges are really trying to solve the problems that matter to people
in
a way that works for them, that's where we want to be. So we'll do anything to just keep staying on this level and working together with great partners.
I love it.
Yeah.
I love it.
Yeah.
Keep up the great work.
Thank you.
Thanks for joining me today.
Yeah.
And we'll be watching how you grow.
Oh, thank you so
All
much.
right. Thanks, Scott.
Okay, appreciate it.